What's up guys, Dr. Hunt again at Hunt Physical Therapy. Today we're going to talk about a source of pain in the butt that oftentimes get misdiagnosed as sciatica or referred pain from the lower back. And it's actually pain that originates from a pelvic joint called the SI joint, which stands for sacroiliac. So I'm going to go ahead and show you where that joint is. On this spine model, you can see it clearly from in front. You have one on the left side and the right side. It's basically the joint where the hip bone articulates with the upside down triangle shaped bone called the sacrum. And so you have one on the left, one on the right, and you can kind of see it from the back here. It's deeper, but there's the right one, there's the left one in there. The reason I think it gets mistaken sometimes for sciatica or something from the lumbar spine is that it's innervated by the nerves of the lower back and the top of the sacrum, which those nerves continue to go on and supply the lower leg. And so irritation at SI joint can actually refer pain down to the foot, just like a pinched nerve from the back. And so we talked about the SI joint. So what flares up the SI joint? Take your pick: wearing high heels, jogging, walking on uneven terrain, some kind of trauma like jumping down on one leg. That joint takes a beating. Basically all the force that translates up through the leg whenever you are weight bearing goes up through the leg, through the SI joint, into the spine. And so that joint, it has to be well protected because it does take a beating over a lifetime. So that can, we think, flare up the connective tissue around the joint. And there's actually a little bit of motion, not much, but about 2 degrees or 2 millimeters of motion at that joint where the hip bone moves on the tailbone. And so we think sometimes it can get stuck a little bit out of alignment or out of position. And so how do we diagnose this if it's similar to the low back symptoms that we've talked about? One of the distinguishing characteristics is the location of the pain. So in disc herniation cases where you have a pinched nerve in the back and it's radiating pain down in the butt, a lot of times it tends to be more lateral or down the back of the leg like that, whereas the SI joint, it's been mapped out. There's an area closer to the sacrum, right in here on more the inside part of the butt, called the Fortin area. And it's actually like a 10 centimeter by 5 centimeter area. And so pain in that area can be the way to kind of do a differential diagnosis. Also, I notice my SI patients, when they sit, a lot of times, let's say it's the right side, you'll find they want to shift off that side. Like it's uncomfortable to bear weight on that inflamed SI joint, which makes sense. One of the things you can kind of do at home that we do in the clinic is lie on your back. Now let's say it's the left side, flex your upper leg perpendicular like this, bring it across a little bit, and put a little pressure down through your femur bone, through your thigh, like you're trying to push this leg bone down into the table. And if that SI joint's inflamed, a lot of times that'll really be painful. So we've already talked about how one of the things that we think happens is that joint will get a little bit out of alignment, like that hip bone will rotate forward or back a little bit. So to treat this at home, what's the first thing that I always have my patients do, if we suspect there's any kind of alignment issue with the joint, before we strengthen, fix that alignment thing. Because if you don't, you're just going to kind of strengthen the muscles in that abnormal position. So that doesn't really serve any purpose. So there's a neat little technique you can do with any kind of like pipe or stick, something durable, baseball bat, at home to realign the hip bones if they're out of alignment. So lie on your back, and you're going to want to do both sides here. So this is called breaking the stick, and so it's called that because imagine you have a stick between your fingers. You're going to break that by pushing down and up on one side and up on the other. So same thing here, just kind of put the stick between your legs like this, and then as hard as you can comfortably push down on one side and up on the other, like you're trying to break this thing between your legs like that. And then you just kind of hold it stable with your arms. So I tell my patients do 3 5-second holds on each side. So down on the right, up on the left here, 5 seconds 3 times, and then reverse it out so that you're pushing down on the left and up on the right here. So count to 5, relax, do it again for 5 seconds, relax, and do 3 on each side. So do that prior to working out, okay? So that'll help realign that SI joint. And a lot of times, if it's out of alignment, just doing that once makes it feel so much better. So try that at home. So let's talk about what you want to do now to strengthen the area of the SI joint. So especially if it's been hurting for a little while, it's guaranteed that the muscles in that area are going to be weak. We've talked about this in other videos. Pain causes weakness. So if you've had pain for weeks and months in this SI joint, these glute muscles are going to be weak through that process we call inhibition. It's not based on exercise, it's based on pain. And so once the pain gets better, you want to strengthen those muscles, make sure that joint's protected and this doesn't happen again anytime soon. So two of my favorite exercises to do on the table are bridging and clamshell. And so you can get these handy rubber bands here on HpT&x real cheap. So take the rubber band, put it where it's around just over the top of your knees, okay? And so spread your feet about hip width apart. And we've done this before for the back, so this will be a review, just a simple bridge. It's a great exercise for the SI joint because it works those hip muscles. It wears the hamstrings and the core. And again, if you remember, just hold for a few seconds, come down in a smooth motion. Now on this one, 3 sets of 15 reps, a few times a week will be perfect. If you want to do more, if you want to do 3 sets of 20, there's no problem with that, okay? The clamshell, let's say the SI joint's on the right side, you're going to lie on your left side, okay? On the clamshell, you lay on your side with your knees bent, your hips flexed, feet stay together here. And to do a clamshell, basically that top leg, you're just lifting it up towards the ceiling. Hold for a few seconds and then slowly come down. I've seen my patients with chronic SI pain, this muscle is so weak, they can barely lift it up and it kind of shudders on the way down, but you just have to kind of work through that. And over the ensuing weeks, you'll notice more strength, less pain, more muscle control. Sometimes just doing this clamshell without the rubber band is challenging enough. So again, 3 sets of 15 a few times a week, 3 times a week. You can do a little more if you want, but I always tell my patients, you want to have rest days in there, so you don't really have to work out every day. So let's see. Another good one to strengthen the hips is hip extension, okay? Just like that. We've talked about this before. That strengthen those hip muscles. Hold for a few moments and slowly come back. So, as a bonus, we've all heard piriformis syndrome, and we'll talk about that in another video, but you know, people with chronic SI pain, a lot of times they've got tightness in that piriformis muscle, which is that muscle that runs obliquely from the sacrum to the side of the hip bone, the femur over here, so it kind of runs in this area. So I find that a lot of my SI patients, it's tight, and so I'm going to show you a great little stretch you can do at home for that. And so we'll demonstrate on both sides. I'll start on the left. So to stretch out that left piriformis, cross your leg like this, and then you can hold the back of your leg, you can wrap a towel to hold the back of your leg, or I just bring my opposite knee to my chest, and that stretch comes on pretty quickly there in the piriformis. And like any stretch, just hold it 30 to 60 seconds. Again, you can hold the back of your leg, or if your arms don't reach and you feel more secure, wrap a towel around so you can hold like that. I don't have a towel handy, but just hold that 30 to 60 seconds. Here's a view on the other side. So to stretch the right side, cross your right leg on your left knee and bring your left knee to your chest. Okay, hold that 30 to 60 seconds. All right, guys, enjoyed it. I hope that was helpful. Again, you don't see the SI joint as often as you see low back pelvic pain due to a herniated disc, but it's out there. And these people suffer for a long time because they'll go to PTs or doctors or whatever and they'll be told it's lumbar and it's actually coming from their pelvis. So that pain in your butt may not be coming from your back. Hope you enjoyed. Appreciate all your support. Please subscribe to our channel. Leave comments below if there's anything specific you guys want to see in the future, let me know. But enjoyed our time together, and I'll see you next time. Thank you.